Hi, Dr. Sweat.
Hello, Tekla.
We are here today on Tuesday, March 6, 2018, and a few of the Atlas Orthogonal Doctors had a couple questions they'd like me to ask you. So I thought we'd take this time to interview you and maybe get some of your casual responses in a little more relaxed atmosphere.
Good.
So today, I'd like to ask from Dr. Deneen Segu, and she said, did you ever imagine that you would practice as long as you have as a chiropractor?
You have to be careful what you imagine because you might get it.
Very true, very true.
And so I certainly am very happy to have done it.
And how many years has it been?
We started practice in April 1950.
Wow. Did you ever even imagine the impact you have made on the chiropractic profession?
Well, again, be careful what you imagine, but I certainly am very fortunate to have some impact on our great profession.
She also asks if it's expected or what you think the future will be like.
The future will make us at this present time look like farmers. They'll have instruments to do the scanning. They'll have instruments to measure the legs. We'll have instruments to check the ganglion, and we will move this profession so far forward, no one will believe it.
That's amazing, Dr. Sweat. Dr. Gary Golombusky has asked, what was Lyceum at Palmer like when you were a student?
It was very encouraging. There was always, BJ rented a tent, and the tent was always full, and he always spoke at the Lyceum, and we enjoyed it very much.
Who lectured and what was covered under that tent?
BJ was the primary speaker, and he would have different doctors come in from different parts of the country and give what was happening in those individual states.
How many were in the student body at that time?
My student class was about 250 students. And that is a miracle that BJ did. Some way or another, he got the government to recognize chiropractic as a profession and to allow the GI Bill people to come in on that. Most all of us were GI Bill people, and even at that time, BJ did have an 18 months course and a 24 months course. And we took the 24 months course, but at the same time, I think it was a miracle that he got recognition for the GI Bill.
Wow. Dr. Gary also asks, it is my understanding that B.J. Palmer lectured to the student body once a quarter.
Oh no, he lectured sometimes every day and at least once or twice a week.
That's fantastic. Did he teach anything in the 1940s or the 50s?
He was teaching through the PA system and not the classes itself in '47.
Did you tour the B.J. Palmer Research Clinic?
Yeah, I was an intern in the Palmer Research Clinic, BJ's clinic. He would adjust the patients, and then we would roll them back into a back room, and they had to lie there and rest 4 hours. And then we would roll them back into his office for him to re-examine them.
Okay. Now Tekla Sweat has a question or two.
Good.
And I would like to know, what was B.J. Palmer really like?
Well, let me say he was a very unusual person. He was fighting one of the biggest professions in the world, the medical profession. And at that time, 1910, the medics were saying chiropractors were practicing medicine without a license, and was even trying to put some of the chiropractors in jail. And yet he persisted and did succeed, and he got a chiropractic license in all of the states. now at this time. The first state to get a license was Kansas in 1911. Georgia got its chiropractic license in 1921.
Wow. Now, when you worked in the Palmer Clinic, were you an intern?
Yes.
And for how long?
We were there like a quarter or so. So we were very fortunate to be chosen to do the intern work in his clinic.
Okay. Now, Dr. Keith Crow had a father, Dr. Hugh Crow, and Dr. Keith Crow asks, how did Dr. Hugh Crow help you along?
Dr. Hugh Crow was one of my best friends, and he did help me design the instrument. First of all, the Grostic headpiece worked on scissors, like this way, and I said, I want a post under the headpiece, and Dr. Hugh Crow had a boat with a jack on it, so we used that type jack to use it, and we had a problem in the mastoid supports, and the people that were making the mastoid support, he changed the support on us, and suddenly the doctors were calling me and saying the instrument wasn't working, and I knew the instrument was working, so I went and took the mastoid support apart, and he had changed the resistance of the rubber under the support, and so I said at that time I'd never let him make the mastoid support again, and I had Dr. Hugh Crow make the mastoid support for us, and then for anybody that was making, and still today, anybody that makes the instrument has to use the support that we use that Dr. Crow designed.
Wonderful, wonderful. So as you go through your years of the profession, what were some of your fondest memories of helping patients?
Well, the part of the problem is you remember the ones that don't respond more than you remember the ones that do. But I was already very fortunate, and my wife and children all grew up to be quite healthy people, and I maintained my health all this time.
I have another question or two, one from Dr. Sonia Popel, and she asked, did you ever have any regrets during this chiropractic profession of yours?
No, there was. In 1950, we were using BJ's adjustment, and they were 38 pounds, and my sister was a long neck gal. We adjusted her, and she said the adjustment hurt her. And I then was contemplating maybe getting out of chiropractic. I said, I don't want to take a chance on hurting anyone. And then I heard about Dr. John F. Grostic's program that was a much lighter type adjustment, and I began to study under him in 1952. But that was the only close to regret I ever had.
Did you ever have any contact with Dr. Gonstead, and how would you describe his character as a professional?
I did take one Gonstead course, and he was here in Atlanta, and he was alive at that time. I wanted to know how he titled his adjustment. And at that time, he was using the term vertebral subluxation complex, and I did not like that term. I think we should say that there's a disc involved and a nerve involved. And so we did say if the patient comes to us and they quit and don't respond good, they go to the medics. The medics say it's a disc and does surgery. So you want to always have in your record that you told the patient there was a disc involved with any peripheral nerve. I did, one thing I agreed with him on, he said some of the curves in the thoracic and lumbar regions are compensatory curves to bear the weight of the head and shoulder. And he said you could adjust those curves in but they'll come back if they're compensatory curves. And we say in our Atlas Orthogonal program that when the head is off center, the body's center of gravity shifts and compensates, and you can't have curves in the thoracic or lumbar areas. And when we realign the atlas, those curves will come back to normal.
Beautiful. Dr. Sonia also asks, did you ever dream that your idea of Atlas orthogonality would become global?
Well, you always hope so, but no, you just do the job and stay on the line and keep improving.
Fantastic. I have another question from Dr. Jared Kohler, and he said, I'm curious exactly what Dr. Sweat's vision is for the Atlas Orthogonal program over the next 10, 20, 30, 40, 50 years.
Tell him it's hard to imagine, but it will be so much advanced. It'll be like difficult to imagine, but we say we got 3 generations. Now the situation with the medical profession, Hippocrates was 300 years BC, and he was the first medical doctor. And so here's 2,000 years that they've had generations after generations that improved their profession. So we're only 3 generations, so we got a long way to go.
He also asks, after a lifetime of focus on the upper cervical adjustment, you have created a magnificent legacy and having brought the AO program into the world for benefits of tens of thousands of hundreds of patients. And he wants to know how you feel.
Well, tell him I appreciate the kind words and the compliment, and we feel like we need to keep doing this and improving. I think B.J. Palmer got us to first base, improved the vertebrae did move. Dr. John F. Grostic got us to second base, improved that they go out at angles in different directions. And then if our generation, the 3rd generation, has added anything, it is that the adjustment can be done with instrument type adjustings. And so one of the problems with hand adjustment, the athletes were the best adjusters. They had to coordinate the muscles. The arms have to coordinate if one goes one way and the other. The long, skinny arm guys, people could bring their arms in easier. And now with instruments, we press a button to do the adjustment, and I cannot press a button better than a young doctor. So now we have the adjustment part of the chiropractic program equal. We need everybody, the doctors, they may not want to do it, but if they want to do it, they can adjust as good as I can. And that's the way it should be. There was one upper cervical group where the president said, nobody can adjust the atlas as good as I can. And that's the opposite of what you want. You want everyone to be able to get the same adjustment. And I can't hit the button better than anyone else, so we're all equal on adjusting. You do have to have the x-rays and the table placement and other things correct, but if we could get those where they can't do those wrong, then I think we would be at home base. Beautiful.
Anything else you'd like to share with us, Dr. Sweat?
Well, I would just like to say it's been a great pleasure for me, and I would like a few more years to do a few more things.